Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is the man himself, Dave Pryor, providing the patient perspective.
Hey, Bryan.
Hey, how are you doing?
Good. How are you?
I'm good. And yeah, I very much value you being on the podcast, my man, bringing a different perspective, sort of outside of dentistry. Now you're involved with talking to dentists all the time, but giving the patient perspective. So if you're new to the podcast, Dave doesn't just bring the funny, doesn't just bring the dancing. He brings the perspective of our patients, which I think is incredibly valued and underrated in our industry right now. Mm-hmm. And I'm going to switch up the topic from what I was going to think of, and let's focus on that right now. The patient perspective during COVID-19 or after COVID-19.
Yeah.
Like I had a whole nother topic that I was doing the intro, and I was thinking, some people who don't know Dave, who've been new to the podcast, they'll be like, why is this guy who's not a dentist on a podcast about dentistry? And as I was doing that intro, I was going, well, it's really important in this time because more than ever, I mean, that's like the biggest cliche, more than ever, but the patient's perspective now is we've talked about for years. I mean, but can you imagine if you have anxiety and then you show up? We got somebody sitting at a desk with a mask on and hand sanitizer
and a face shield
and got to take your temperature. And I mean, man, what are your thoughts on that?
Well, I think you've certainly dreamed your entire life of being able to wear the Darth Vader helmet as part of your job. So
it's more the lightsaber thing. I mean, just turning the thing on. That's all I want to be able to do.
And that's why you're in the technology industry.
Yeah, that's true.
No, I think that the patient's perspective, and certainly this really gives those people that have dental anxiety just one more excuse not to come in.
Oh, it's about 12 more excuses.
Right,
yeah.
and it's a big one. And so being able to overcome that is going to be a big challenge for the industry, I think.
I agree. And I think I've seen some really good examples of people doing some cool things to overcome that. People I see like, there's one office I saw that the assistants and hygienists, and I think the dentist was in there, they had their face shields on and they had their touchless thermometers and like Charlie's Angel did up. Like I thought that was pretty cool. Mm-hmm. That people who some of the hospitals, and this is one of the things that we're looking at doing at my office, where they have like a smiling face or goofy picture of you, because if you're wearing a mask the entire time and having it on you, things like that, I think can go a long way. Because at my office, we talked about how I feel like half the people came to our office for coffee. Like, we have the little coffee, the Keurig thing, and people loved it. I mean, the reviews that we get about the coffee, it's just like, okay, I mean, I guess that's good because they're not like, they're focused on that experience. But I mean, we're not like a dental spa. We've always been focused on, clean, sterile looking environment, with little clutter and really executing the highest quality, leveraging technology to give people the best clinical experience, which as you know, and we've talked about on this podcast, a lot of that has to do with providing. I feel that efficient care is quality care, right? And the patients don't want to be like, if they can have the same procedure be done in half an hour versus an hour and a half, and I feel like that can be done at a higher quality because you actually know what you're doing. You're not like stumbling around. Yeah. That's like a key, and I think that's even more so now. Again, the cliche, but I think we have to look at the way our patients are experiencing this tremendous shift as we are. I mean, it's weird for us to have to be putting on surgical caps if you're a general dentist, and disposable gowns and N95 and face shields and all of the PPE that we've also talked about on the podcast. And it's a stressful time for everybody, but really, this is a good time to focus in on patients.
Yeah, well, and when wasn't it really? But now it's got to be retooled, and the industry as a whole is going to have to get around a way to market yourselves that it's safe, and I really am going to be curious to see how that evolves over the next few months, because practices are starting to open back up across the country. So how are they going to change? And you've pointed out a couple examples, but it's going to be a fundamental shift. So what is that going to look like? And what as a patient, how am I going to feel walking into a dentist's office, or checking in the parking lot versus going into the waiting area like normal? You're going to reinvent the whole process of how my experience is. So what's that reinvention going to look like? How are you going to make it comfortable for me? And how are you going to separate yourself from dentists that aren't doing the right things from the dentists that are?
Yeah, I think you brought a lot of good points. I think that, frankly, certainly the people who are listening to this podcast are going to be doing the right things, right? You're engaged,
Right.
You get it, you're listening, you've already been looking at PPE, and your concerns right now are getting enough disposable gowns or gloves, or whatever the shortage is now. But I think that the big takeaway thing here is really focus on communicating what you're doing to your team and to your patients. To Dave's point, it's about building confidence in our patients.
Yep.
Right, and not even just confidence, but the unknown is scary.
Yep.
And the unknown, it builds anxiety.
Yep.
And so, it's a great point. So we added to Upgrade Dental, our educational platform, a video for everybody that joins Upgrade can get to put on your website that talks about what it's like to go to the dentist in the new reality, that we take your temperature, and when you come in, we'll be giving you a face mask, a mask to wear until you come back to the operatory. All the steps that we're doing as an industry to keep people safe during this time. I do feel that most dentists are. I was worried about it initially. There are some dentists that I think are going to be caught flat-footed and aren't going to be checking the boxes. And frankly, I think they're host. I mean, I think that if the patients may not know, but their team members are. And right now, that's a whole nother podcast that we can talk about. Is the friction between team members and dentists right now during this time, which is unfortunate, because we really need to work together on providing care for patients. But it's really going to be about just letting people know what to expect, to put them at ease, because most of us are doing a lot to address this situation, but you can't keep it quiet. You have to have it on your website, pushing it through social media, send out the mass emails to your patients so that they know.
It's interesting, as you were talking, I was thinking about this. Before COVID-19, when I went into the dentist's office, it was, to maintain my teeth. Mm-hmm. And I'm like, I really thought of it almost like getting a haircut. Mm-hmm. I'm just, I go get a haircut because I'm maintaining my hair. I go to the dentist because I'm maintaining my teeth. Now I'm going to the dentist's office. It feels it's going to feel much more like a medical experience than it did previously. And I'm really going to be curious if that continues moving forward, if it stays as feeling as a patient like a medical experience, or is it going to be back to, general maintenance is what I come in to.
Oh, Dave, I've never been. It's like, I'm so proud of my baby boy. I mean, no, because I think that's such an, we start off this podcast talking about you providing the patient perspective,
yep.
But I think you just hit on an industry trend that's going to come out of this that I don't think most people in the industry recognize.
Yeah.
So, I mean, absolutely 100%. And frankly, we as a company, we as an industry, we are going to be going in that direction in a big way.
Yeah.
I think there was this slow, steady trend towards overall health and dental health crossing over, cross-pollinating.
Yeah.
But I agree with you. I think that this is going to catapult dentistry into more of a essential medical piece.
Yeah.
I was going to go down the pathways of how oral health is connected to overall health, and every dentist listening knows those touch points, and probably recognizes that we're not doing that much to address those issues.
Mm-hmm.
And overall health, I think, coming out of this comprehensive, looking at your comprehensive health and your oral health in the same vein,
yep.
is going to be a huge trend coming out of this.
Yeah.
And that is the patient's perspective. You're right.
Right.
That's why.
Yeah.
That's why.
And that's, this is the podcast where we're talking about the patient's perspective. And that has certainly always been mine. Now, I knew you when you were going to dental school. And, Bryan went to the University of Minnesota, where when you go to dental school, you're in school with the medical students.
Yep.
And so you're essentially going to dental school and medical school at the exact same time. So you're doing double the work.
The core courses are all you take
right.
them with them.
Yeah. And so it was a tremendous amount of work when you were going through dental school. And I was stunned, like you had to learn every bone, every muscle, and how the entire body works in order to become a dentist.
Mm-hmm.
And so it was, for me, as somebody that isn't in dentistry, it was fascinating, and I was just like, why? And as I've gotten to know the industry from the outside over the years, I'm like, all right, well, it makes more sense now. Mm-hmm. But it's, you're all doctors. Like it's not, it's not just, you're working on teeth and you're, scraping the teeth and move on and, maybe do a filling or a crown and, glue that there. There's a lot more to it. And it really is becoming very, very evident, certainly to me in terms of how much attention is being paid by all the doctors that I'm talking to on a regular basis on the medical side of dentistry right now. And so all of you, and we often talk about how our audience is, ahead of the curve. Well, I'm sure it kind of sounds like we're trying to play up to the audience, but it's really not the case. I think the reason, if you're listening to this podcast, that means you're actually taking those extra steps.
Oh yeah.
And so it's not us like playing to the audience. It's a fact. It's you're actually engaged. Where Bryan talked a few podcasts ago about how most dentists are catching up on Netflix right now. Mm-hmm. And I'm like, the people that I'm talking to definitely are not.
Yeah.
And they are going from webinar to webinar to webinar. And I'm sure every one of the listeners here, that's exactly what they're doing too. So it's from my perspective, it's encouraging to see that in this time, where it's pretty dangerous to be in this field, that there's a lot of genuine concern about how to move forward.
Yeah, I think that you bring up a lot of great points, and I think that the audience that listens to any podcast about dentistry is ahead of the curve.
Yes,
right, because they're engaged, they're trying to learn, and that's not everybody.
Right.
So that those are the exceptional ones, and then frankly, we don't advertise this podcast. No. I mean, so if you found us, right, something happened, right? So we're not out there promoting it, but just frankly, because if it ain't broken,
yeah,
right. But I dentistry as an industry has been in the news a tremendous amount during COVID-19 because of exactly what you're saying, and I never put the two things together. That the reason why is because people, the news organizations are going, there is dentistry is a medical procedure, and it's like people are waking up to that because of not being able to go into the dentist. And that is not going to be a shift in the psyche of our patients that's going to disappear, right? They're gonna look at us as the medical professionals that we are.
Yeah.
And like you said, it's interesting that you said that, because I hadn't really thought about it before. We go through dental school, we know what we know and what the training we get, but the average patient doesn't. And so it's taken this pandemic maybe for their eyes to be open to that, and that's not going to stop. And I think the opportunity for us to help our patients beyond their teeth is going to be huge going forward. Right now it's going to be about educating people about how the changes that we've done to keep them safe, to keep our team safe, what we're doing. So make sure to communicate that to your patients today. But I would also, like, if you've got like a 1-2 year horizon that you want to think about, getting into comprehensive, getting into more comprehensive health, complete health versus just oral health. And I say just with, obviously that's our focus in what we do, but there's going to be quite a bit of cross-pollination with overall health and dental health over the next few years.
Yeah.
I agree with you.
Yeah.
The great insights, man. I appreciate you more than ever being on the podcast today.
Well, I'm glad I can help every once in a while from the mouths of babes.
Thanks, sir.
You got it.